Joining us live from Ballad Health is Chief Infection Prevention Officer Jamie Swift. Jamie, thank you for being here as always. We'd love to see you. Thank you.
Thanks for having me.
Let's talk about those numbers in a moment, but first off, mask mandates were dropped last week in 3 local counties. We're hearing tonight Greene counties will be expiring on Saturday and the mayor's not going to renew it. You expressed some concern about that on social media. Help me understand why you're concerned, and are you still concerned?
Well, I think regardless of mandate, the request from our mayors that we very much appreciate is that people still wear their mask. And I understand, the need to change that from a mandate to a request. And so our message has not changed. My message for prevention has not changed. Right now, we still need to make sure that our citizens are wearing a mask, social distancing, washing their hands, and getting that vaccine just as soon as they're able to.
Let's talk about numbers tonight. As we showed a moment ago, 85 in your hospitals as of the census report today. We'll hear from you again on Wednesday. That's up a little bit from where we were a few days ago, but way down from where we were a few weeks ago. How confident are you tonight that that downward trend is going to continue?
I think we're cautiously optimistic is kind of where I'm at right now. So, obviously we're trending down and that's great and something to be excited about. We still need to really kind of see what's going to happen over the next few weeks. We need to make sure that people are continuing to mask. We need to see if we start to see the variant strain here. So there's still a lot of unknowns and factors that it's a little too early to start celebrating just yet and thinking we're completely out of this. We're not. There's still a lot of factors that really need to be watched and monitored over the next few weeks.
You've said in previous visits that the downward trend is attributable to people just doing some smart things. We missed that feared surge because people were wearing masks and socially distancing. And do you think we're also starting to see the impact of the vaccine in our area? About 1 in 10, has gotten at least the first shot. What do you think?
I do. I continue to think it's really a culmination of many activities. So certainly the things we've talked about in the past, but also, we're past the holidays now, so maybe a little less travel right now during this time. You certainly have vaccine, and we've been vaccinating those most vulnerable people. So those 75 and older, and now Tennessee's moving to 65 and older. So certainly you have to believe that vaccine is making some sort of impact on our cases in our hospitals.
It's good to hear. And we continue to hear that for some, that second dose is a humdinger, that they feel pretty rotten for a day or so afterwards, and then it's back to normal. That's a lot of anecdotal from me to you. I'm sure you're probably hearing it as well. I'm wondering if for some, that could be I don't want to deal with that. And what would you say to them about those stories that we keep hearing about that not feeling great after the second dose?
Yeah, so, it's very normal. It's very expected to have that immune response, especially after that second dose. And I encourage people, it comes on pretty suddenly after that second dose, but what we hear is it goes away just as suddenly. So, they may have those symptoms for 12 to 24 hours, but for the most part, those symptoms resolve on their own very quickly. And there's several tips from CDC to kind of help lessen the effects of those symptoms. So cool compresses. You can certainly take Tylenol after your vaccine. You don't ever want to take it before you go. You want that immune system to have that response. But people just need to remember, certainly that response is so much better than having COVID. You never know if you get COVID, even if you're young and healthy, if you're going to have severe disease. So I encourage you to put that fear aside and go get that vaccine.
And Jamie, finally, we are seeing a lot of people in our area are now through that second dose, and they're probably older folks or they're, in that frontline first responders. When is it okay for them to go see the grandkids, and let them just have kisses and hugs again? When are we going to get there for those who've had that second vaccination?
We're kind of in that phase. We're gradually getting there. So certainly if someone is fully vaccinated and their risk to themselves is much lower, they can make that family decision at this point and decide, what's the risk? What are the other risks to individuals in the family? What's the risk to seeing the grandkids? The risk to the grandparents at that point becomes pretty minimal. And so, those are just family conversations you need to have. I think the main message is right now, keep wearing those masks, keep doing the things that we need to do. So even if you visit, everybody wear a mask just to make sure that we're keeping spread down, that we're not having any transmission of variants and things like that.
Here's to the continued downward trend. Jamie Swift at Ballot Health tonight. Thank you very much. We appreciate it.